Technology and its role in medical care and education, advantages and challenges in practical implementation. Presented by Irina Yaho, Assistant Lecturer at University Ismail Cemali, Vlora, Albania, and PhD candidate at University Tor Vergata, Rome, Italy. The role of technology is very important both in healthcare as well as in medical education, that is, in the knowledge that students of medical branches receive during their schooling years or during various trainings in the framework of lifelong learning. The use of technology in medical education helps to improve the quality of education and to prepare better students to become successful physicians in a diverse healthcare environment. The implementation of technology in medical education is used in various ways to improve the learning process in the field of medicine. So, for students, the technology can be implemented in some ways. Online learning platform. Universities and higher education institutions can use online learning platforms to offer different courses, learning materials, tests, and additional resources to students. These platforms, such as Moodle, Blackboard, or Canvas, provide a virtual environment to attend classes and communicate with professors and other students. Medical simulations. Medical schools can invest in advanced simulation equipment, such as mannequins that are capable of reacting to various medical procedures, or virtual simulations that allow students to practice procedures in a virtual environment. Medical applications. Medical applications can be created and used for various training and learning, including applications for the treatment of specific diseases, anatomy, pharmacology, and many others. Virtual and augmented reality can be used to create immersive learning environments, allowing students to explore the structures of the human body in new ways and practice medical procedures in a realistic way. Online conferencing and seminars, video conferencing technology, and online seminar platforms allow students to participate in presentations and discussions remotely, providing opportunities to share knowledge and experiences with professors and other students from around the world. Artificial intelligence and data analytics can use to personalize learning for each student, providing personalized instruction and materials based on their individual abilities and needs. The impact of technology in patient healthcare. Technology has an important role in improving healthcare for patients in many and varied ways. So, here below are some ways how technology can impact healthcare for patients. Electronic patient records help store and access patient health information easily and efficiently. This allows healthcare professionals to access the most up-to-date information about patients, improving care coordination and patient safety. Telemedicine provides the opportunity for remote medical consultation and monitoring of patients through telecommunication technology. This is important for patients living in remote areas who have difficulty reaching traditional health services. Health apps. There is a wide range of health apps that provide health monitoring, disease management, healthy lifestyle tips, and much more. These apps can help patients monitor their health and make informed decisions about their care. So, health apps are very good used in the medical adherence, and this medical adherence help people to have a good result of their treatment. Advanced diagnostic tools such as CT scanners, MRI, and other equipment provide more accurate and detailed information about the health status of patients, helping to diagnose and treat diseases. Artificial intelligence and data analysis are very effective for treatment and personalized care for each patient. Mobility and health monitoring devices such as smartwatches and various sensors can help patients monitor physical activity, sleep, heart rate, and other vital parameters, providing a complete picture of their health and help prevent diseases. Health monitoring devices. Here is a schedule of some link between information and intervention. So it's very good implemented the way that how people can use some devices like heart rate and respiratory rate that monitor this vital parameter, and how to give this information to family, to clinician, or to emergency if they need the emergency. Advantages of technologies to health professionals, patients, and the health system. The use of technology in patient care brings many advantages to health professionals, patients, and the health system in general. Improving access and coordination of care. Technology serves as a tool to facilitate access to health information and coordinate patient care efficiently. Electronic patient records, online health systems, and medical applications allow health professionals to access fresh and actionable information about patients. Telemedicine and remote care. Telemedicine provides the opportunity for medical consultation, patient monitoring, and remote care delivery, improving access for patients who live in remote areas or who have difficulty reaching traditional health services. Advantages of technologies to health professionals are as below. More efficiency and productivity. So, the use of technology often increases the efficiency and productivity of healthcare professionals. Automating some administrative processes, such as customer service and file management, allows more time to focus on patient care and treatment. Improve diagnostics and personalized treatment. Advanced diagnostic technologies, artificial intelligence, and data analysis help identify diseases in the early stages and choose the most efficient treatments for each patient. This brings about an improvement in the health and a steady progress in the patients. Advances in patient education, health apps, and online resources offer patients the opportunity to learn more about their health conditions, follow up on treatments, and receive health lifestyle advice. This increases patient awareness and responsibility towards their health. This is monitoring and prevention. Health monitoring devices, artificial intelligence, and data analysis can help monitor the health of patients and identify the potential risk of diseases, allowing progress in their prevention and management. But technology, as we said, has many advantages in the field of medical and health education, but also has some disadvantages on the other side. For example, high cost of implementation and maintenance. Devices and technological platforms for medical and health education usually have a high cost of implementation and maintenance, so this can be an obstacle for health institutions or as well as for universities that do not have sufficient financial resources. Lack of equitable access. Technology can increase the social divide in medical and health education by creating a gap between those who have access to advanced technologies and those who do not. This can worsen equity and fairness in access to health education. Data privacy and the security concerns are some other disadvantages. So, the use of technology in the storage and sharing of health data raises data privacy and security concerns. The risk of health data piracy and breach of privacy can affect the credibility of patients and health professionals. Another disadvantage is that the use of technology such as telemedicine and online communication can significantly reduce human to human interaction between health professionals and patients. This can lead to the loss of important aspects of healthcare, such as a sense of empathy and the thorough understanding of the patient's need. In some cases, there may be an over-evolution of technology at the expense of basic human skills and experience. This can lead to dependence on technology and loss of traditional medicine and healthcare schemes. At the other side, there is a lack of universal standards and interoperability. In the field of technology, health technology, there is a lack of universal standards and interoperability of electronic patient records and other applications. So this can make difficult to share health information between different institutions and devices. But disadvantages of technology are also present for the staff. So the staff needs for training advance is always present. Technology implementation often requires advanced training for healthcare staff to learn to work with new equipment and system. So this can require considerable time and, of course, resources for health institutions. Additional workload. In the beginning, using technology means an increased time to learn and change the work routine. Using electronic patient records and other health applications can require tedious time to fill in information and coordinate care. Using technology in a healthcare setting can bring also stress and fear to staff due to fear of job loss, changes in work processes, or lack of confidence in their new technological skills. Healthcare staff may have concerns about the privacy and security of patient data when using new technology systems and devices. The risk of hacking health data can cause anxiety and stress in the work environment. Like any technology, health equipment and system may experience outages or technical problems, so this can affect the efficient use or quality of care provided, creating stress and frustration for healthcare staff. The use of technology, especially in telemedicine or remote care, can create a sense of distance between the patient and the health professional, reducing so the sense of connection and empathy in healthcare. But technology has also some disadvantages for the patient, like lack of sense of humanity and human connection. The use of technology, especially in cases where care is provided through telemedicine or online platforms, can reduce the sense of connection and empathy between the patient and healthcare professional. This can affect the quality of care and the feeling of safety and support for patients. Vulnerability to technological constraints and equal access. The world's technology use has created a gap between those who have access and skills to all those who have and the necessary platforms and those who do not. Patients with good technological or economic skills can get sick or feel their ceilings from these services. Privacy and data security concerns are also another problem for the patients. Missing patient experience. For some patients, technology of potential life care is difficult or unpleasant due to the reasons of a feeling of completion or use of new technology. This can lead also to feelings of isolation or lack of trust in caregiving. Facilitating self-diagnosis and self-treatment. Information facilitated and accelerated by the internet and health apps can lead patients to self-diagnose and self-treat. As we know, it's not a good thing, increasing so the risk of care errors and worsening health conditions. So, to address these disadvantages, it is important for health professionals to strike a good balance between using technology and maintaining human connection and empathy with patients. Also, it is important to develop training for patients regarding the use of technology and to ensure that they have equal access and an appropriate health care experience. So, here are some recommendations for the efficient inclusion of technology in health. And these recommendations aim to ensure a sustainable and effective use of technology in health. Health institutions and governments must continue to invest in innovation and technological development in the field of health, with the development of new health applications, integrated platforms for electronic patient records, and the use of advanced diagnostic and treatment technologies. It's important to build interoperable and standardized platforms for electronic patient records and health data that allow the exchange of information in a secure and stable way between health institutions and different devices. Governments and health organizations should promote the use of technology to improve the health of population and so promoting healthy lifestyles and proactively monitoring health. It's important to place a high priority on the security and privacy of health data and the use of technology. This includes the implementation of advanced security measures of compliance with applicable legislation for the protection of personal health data. Health professionals and patients should be educated and made aware of the benefits and challenges of using technology in health. Appropriate training and guidance are essential to ensure that the technology is used effectively and safely. Technology should be used to advance scientific research in the field of health and to help to share knowledge and good health practices globally. Thank you for your attention.